My name is Brad Tatko. I was born in Pittsburgh, Pennsylvania, but my family and I moved to Greenwood, South Carolina when I was a young child. I am a senior biological sciences major with a minor in chemistry. I plan on attending medical school after I graduate this upcoming May. My long-term medical goal is to become an orthopedic surgeon. I have had this desire to become a medical professional ever since I have arrived at college. And throughout the course of this class, I hope to learn valuable skills that I can apply to my future professional career. I have a background working in a chemistry research lab for a year while here at Clemson University. I also have over 100 hours of medical shadowing. My observational experiences include ear, nose, and throat surgeries, orthopedic surgeries, as well as medical office observation. Doctors use two primary technical documents. The first and most important one is a patient's file, also known as a medical record, health record, or a medical chart. These names are used interchangeably to describe the systematic documentation of each individual patient's medical history and current medical illness. Both the attending nurse and the medical doctor use these documents. These documents are used to systematically enter treatments, medications, test results, x-ray results, as well as any other additional comments. The maintenance of complete and accurate medical records is a requirement of healthcare providers and is generally enforced as a certification prerequisite. I had a discussion with Dr. Jackson, who is a physician at the ANMed Urgent Care, about the documentation that he uses on an everyday basis. Dr. Jackson said that they are actually moving away from a paper documentation and are moving everything to a digital format. And with this digital format, the medical field is trying to move to a universal medical file system so that doctors all over the country can access patients' files from other offices the patient may have visited in the past to better treat the patient's current illness. The first part of a medical patient file is the patient basic information, which includes name, place of residence, date of visit, and some other basic information. The next section is for the patient's current physical measurements, including height, weight, blood pressure, and any additional comments about the patient's physical conditions. The third section is for the patient's reason for the visit and any tests, if any, that are going to be run. This is followed up with the test results section, which will be filled out once any tests have been run and the results are returned to the doctor. After this section is the x-ray section, and after this is the treatment section, which includes medications and dosages. The very last section of the patient file is for any additional notes and comments that may be useful for future visits or treatments. The second type of technical writing used by medical doctors is a medication information form. The medication information form includes the brand name of the medication as well as the active ingredients of the drug. It also tells how to store the medication and how to dispose of any leftover after treatment. This sheet also includes information about what drugs are okay to mix with this particular medication, as well as what to do in the case of an overdose. This form also includes all possible side effects that can be expected when using the medication. Medication information forms are a very important document used in the medical field, considering that there are new drugs invented every year that every doctor has to be aware of to be able to treat patients in the most efficient manner. These forms are the two most common forms of writing and record keeping in the medical field. Every field of the profession uses these forms of technical writing almost every day on the job. These forms must be written in a very concise and factual manner so that there cannot be any misinterpretation of any of the information found within them.